Our lovely patient, who's 48 years old, is about 3 months out from remove and replace of her implants because they were displaced, as well as a revision abdominoplasty. And she's very kindly agreed to share some of her thoughts and feelings about what was frustrating her and how she feels about her results at the moment.
Sure. I was frustrated because I felt as if, especially my one breast other than the other, would fall to the side, and it kind of was uncomfortable. It felt like it was almost under my arm. Right now, what I can tell you is I haven't bought a bathing suit in 3 years, and I was excited. I actually bought four bathing suits. I'm very happy with my outcome.
That's fantastic. It's fantastic. And so a couple of things. How long had you had implants in before we revised them?
About 20 years.
20 years.
Yep.
And had you noticed them getting progressively further displaced?
Yeah, I thought it was mostly skin at first, just, normal aging, I guess. But then as I was lifting and stuff, I can feel it, and that's when I started to think something was wrong.
Yeah. It's a huge topic of conversation and discussion amongst plastic surgeons, and obviously we bring patients into it, whether the implants are optimally in front of or behind the muscle. Certainly 20 years ago, pretty much the standard of care was to go behind the muscle, and yours were saline, which is yet another strong reason to go behind the muscle. And today, with some of the newer silicone implants going in front of the muscle, there's a lot more flexibility and options. You and I, mostly you, after discussing, wanted to continue with saline, so we redid saline implants behind the muscle. And you were phenomenal in being understanding about the techniques and options that would give you the optimal result. So we talked about using the GalaFLEX product, which is that weave, if you will, or that hammock of suture material that I could use to sling and hold your implants into position and give you almost that internal bra, which is sort of the buzz on all the internet today, people talking about this. And it's really a great tool, certainly for revision operations. Sometimes we use it in primary, but honestly, it's the workhorse for revision surgeries. Share with us what your results were like immediately afterwards and how things have settled in over the last 3 months.
So immediately, I will say I was a little nervous. Mm-hmm. I also had the lift, so it was just a little bit scary looking, but I had trust in the process and just tried not to dwell or look at it necessarily. And then as the time went on, I was just getting happier and happier with the look, and now I'm very pleased.
Yeah, it's absolutely. They sort of settle into that pocket, and then they're beautifully held. And we were talking before we started this recording that sometimes you feel comfortable enough going without any support.
Yes. Yeah, before I could not. Now, if I want to wear a special shirt or something like that, I really don't have to think twice. I could just put it on, and I still like the way it looks.
And your breasts stay right where they currently are. That's
yes,
perfect.
And when I lay down, they don't go off to the side.
That was the other thing. We actually took a picture of you, didn't we?
We didn't take a picture, but we did try it out.
When you were laying down, your breast falling off to the side.
Yes.
And patients who have implants find that extremely frustrating. And so does that happen anymore?
It does not.
Perfect. And then in terms of your tummy, you had a tummy tuck.
Also 20 years ago.
Also 20 years before. And when you and I met about this, I think to describe your abdomen, it was quite wavy and irregular.
Yes.
And I think, did we talk about a possible reverse tummy tuck where you pull up?
I'm not sure. I know we talked about different things. I don't remember.
Yeah, but I think if we did, I'd probably talk to you out of that very quickly because I try to avoid that operation if I can. But what we wound up having to do was we had to basically take where your belly button was all the way down to your mons or your old scar and take that entire tissue out. And in the process, we had to rebuild your belly button.
Correct.
And so describe what your results feel like now.
They feel good. I mean, I have a scar there, but that doesn't bother me.
Yep.
And I'm very much pleased with the look of my belly button. And when I have just even a surprise, because before I'd have to wear like a high bottom bathing suit, I don't even have to. I could buy a normal bathing suit bottom, and the scar is completely hidden.
That's so good. Oh, because I was able to lower the scar. I was able to pull it down lower. Well, you were great to have faith in the system and in the process, and your results look spectacular.
No, I'm very pleased. Thank you. And if you're debating it, just go for it. He's great.
Well, that's always the last question I like to ask, and that is this something you would recommend to a friend?
I would.
Oh, you're so wonderful. Well, thank you for sharing your story.
Yes, thank you.